Dr. Peter Bray is a cosmetic plastic surgeon on staff at Toronto Western Hospital. He's assistant professor in the Faculty of Medicine at the University of Toronto, where he's very involved with the training of plastic surgeons. And he also has a private cosmetic surgery practice. He's here tonight to talk to us about the kinds of procedures people most often want and the latest in non-surgical refreshers. I was telling my audience that one of my suggested I get a refresher for the frown line between my eyes, and I told her she could take a long walk off a short pier. And now here I am just a few years later contemplating an entire facelift in 5 years.
Well, that's quite a jump from one to the other.
It sure is. So, tell us the truth about Botox. I mean, we see so many plastic faces in the media.
Yeah.
Are we going to end up looking like that if we start down this road?
Oh, goodness, no. And with any treatment, whether it's non-surgical or surgical, a lot has to do with the restraint and the sensibility of the practitioner. And Botox can be overdone, and it can also be done sensibly and tastefully. And done that way, it's terrific. It's quick, effective, and one of the most easy-to-access cosmetic treatments out there.
Okay, so I've seen some research that shows that if you Botox out the furrow between your brow, you can actually reduce your incidence of depression. I mean, I'm not asking you to comment on that, but because I've seen the research on it, and the reason being that your brain believes what your face feels.
Yeah, that's an interesting study, just a recent one, actually. I kind of get that impression in treating a lot of people with Botox. Now, of course, I'm inherently biased, but there is this little bit of science now to back it up.
Yeah. So, what kinds of problems will the Botox solve?
For cosmetic purposes, it's creases, lines, wrinkles that are caused by the action of muscles. So that applies to the number 11s, the ones that show up in between the eyebrows, the horizontal creases of the forehead, and the little creases and wrinkles out beside the eyes.
The laugh lines.
Yeah, the laugh lines. And it can also help to improve the shape of the eyebrows by lifting portions of it, and it all of a sudden makes you look as though you got a really good night's sleep. A quick refresher, if you will.
So how often, I mean, this is one of the questions I've always had, is that, okay, so I go to the trouble to Botox out the 11s between my eyebrows, and then how often do I have to keep doing it?
On average, it'll last about 4 months. Sometimes it'll be longer than that, depending on the person and how active those muscles are. But for most of my clients, I expect them to be coming back about 3 times a year.
Okay. And how many different things can you do at the same time? Because, like, if I'm going to come all the way to Toronto to have my 11sies removed.
Sure. Well, often a combination of things that we'll do. Botox goes hand in hand with what are called injectable fillers. That's another very popular way to reduce some of the signs of aging and refresh. So many people will come for both of those things and sometimes add a skin treatment or another process in the same visit.
Now, I noticed as my skin gets older that it gets these little bumps, and it's like accumulation of cells in places that there weren't before. Is there a treatment that removes these? This isn't acne. This is like weird skin. Are there treatments that remove that safely without causing scarring? Because I expect that that's a concern for a lot of people who are thinking about doing it.
Well, sure. Removal of bigger types of bumps, let's say they're cysts or something of that sort, will leave some scarring. Now, usually having a small scar is better than having a lumpy thing in terms of the overall appearance. You can expect that a bump, an irregularity, a skin blemish of some sort can be improved through one method or another. It is the sort of thing where the practitioner would need to have a look and make a diagnosis and then figure out the best treatment option. But pretty much any skin problem or issue has a solution to help improve it at least a little bit.
So are you seeing more men coming in for little lifts as opposed to, because I know this was a field that was predominantly a female field for a long time.
It had been, yes, and now more men are becoming comfortable with the idea of cosmetic treatments. That's become a big part of my practice, probably close to 40% these days.
Really?
Men are realizing that having these treatments done isn't an affront to their masculinity. The internet has really liberated things where men can learn about these treatments anonymously, not that they have to sit around at the pub and ask about cosmetic treatments amongst themselves. So
can't you just see that? Oh, fellas, these laugh lines around my mouth, I just got to do something about them because they just seem to be getting deeper and deeper every year.
That's right. Yeah, men, they just don't tend to talk about these things. The internet's really helped. And the other thing that's made a big difference is now there are more treatments that are quick with minimal downtime, safe and effective. In general, men don't tolerate downtime quite as well. For them to be able to get back into the gym and back to work without having to spend a lot of time in recovery, that's a big bonus.
Yes. Listen, I need to take a break. Will you stick around? Because I have a couple more questions I'd like to ask.
Oh, for sure.
Terrific. I'm Gil Vaz-Oxlade, and you're listening to The Late Shift on In-Depth Radio, News Talk 1010. I'm on the line with Dr. Peter Bray, who is a cosmetic plastic surgeon and on staff at Toronto Western Hospital. He's also assistant professor in the Faculty of Medicine at the University of Toronto, and he has his own cosmetic surgery practice. So I'm curious as to what things have become more popular and which things have faded, because I expect there's some sort of cycle to this in terms of what people like done and what goes in and out of fashion.
For sure. So the techniques and technologies do change. That's one factor. And also people's cosmetic or aesthetic interests change. So one of the things that's really become popular is rejuvenation of the backside. Particular.
So people are now obsessed with their butts?
This is kind of true, yeah.
Okay.
The so-called Brazilian
I want you to know I have
lift.
a fine backside that needs no work, okay?
Oh, that's, well, good. I'll keep my hands off it.
Okay, so backside reshaping.
Yeah.
Okay, what else?
The Brazilian butt lift, as it's commonly known, is one of the more popular things these days. 10 years ago, you'd scarcely have heard or even thought that people might be interested in this sort of thing.
Having their butt lifted.
Yeah, a bit of a change in people's ideals, appreciating curves and of a more voluptuous type of figure, largely.
Amazing. So even as the diet industry is growing by leaps and bounds, and I expect you get an equal number of requests for liposuction, we also have women who want a curvaceous butt. We think we probably can thank Kim Kardashian for that.
Well, sure. Kim Kardashian, Beyonce, Jennifer Lopez, their visibility of this type of shape and desire to have it.
I met a girl on one of my shows, and she had a nose job, rhinoplasty, right?
Yeah.
And I thought, and she'd gone into debt for it, and I thought to myself, geez, I just want to slap you for that. But then she brought out a picture of herself prior to her nose job. And showed it to me, and I went, okay, I totally get why you spent that money. So, there are situations where it is not strictly vanity in terms of I don't want to look like I'm getting old. There are issues that significantly affect people's self-esteem that can be corrected if you go to the right person.
Yeah, absolutely. There's any number of good examples of that. Noses are certainly one. The other thing that's becoming more and more popular is male breast reduction. Many
Boobs.
men have breasts that are disproportionately large for their
Yes.
frame, for their size, and
Yes.
being closely associated with femininity, that can really weigh on them in a huge way. So becoming very popular to get that corrected now that there are very good methods and techniques to do it.
Okay. You're a pretty cute guy. So what have you had
Thanks.
done? You're welcome.
Well, I'll admit I get Botox regularly. I think it's terrific. I had a terrible set of number 11s, and since I've been getting Botox, it's helped to take the edge off of that. And I guess a little bit of that is practice what I preach. And I have no reservation about admitting to that.
So do you think the stigma associated with plastic surgery, this whole idea that, you have to be some kind of stupid, vain cow to want to put yourself under a knife to look pretty, do you think that stigma is going away as this becomes almost like a routine procedure?
It is going away, yes. Plastic surgery, cosmetic surgery is definitely becoming more mainstream, and no longer is it just something to be indulged in by the wealthy and idle people who can spend all day looking in a mirror. That's not the case at all. These really are regular people, for the most part, who want to make changes that are meaningful to them. And rarely is it about prancing around in a bikini on the beach in Rio. People just want their own clothes to fit better, have a better proportion, feel good about themselves, maybe wear a bathing suit more comfortably, enjoy their shape without having to think about it.
Are people coming to you at a younger age? I mean, one of the things that I was a little appalled at, to be perfectly frank, was the number of 20-year-olds I worked with on Princess who were already into the Botox. And I thought to myself, oh my Lord, if you are Botoxing at 20, what the hell are you going to look like when you're 40?
Younger people are having cosmetic treatments done, and Botox is maybe one example of that. But more of it would be laser hair removal, light-based treatments, skin care, and that sort of thing. By and large, this is still the domain of people who are getting into their later years, late 20s, 30s, 40s. That said, having a little bit of Botox for helping to shape the eyebrow, if that's done with restraint, it's never going to cause long-term problems. It really is a very safe and very effective treatment when done correctly.
Is there a way to get rid of the wings under your arms?
Yes, there are, and one of the
because that's one of the things a lot of my friends complain about the most. They hate that when they hold their arm out straight to the side, it keeps moving.
Yeah, that's right, and hold their arm out the window and it flaps in the breeze. I've heard them all.
Yeah, exactly.
Yes. Well, one of the most exciting treatments I'm using for that these days is a new type of liposuction called Body Tight, which allows me to remove a bit of extra fat under there, but also gives much better skin tightening than other types of liposuction. And that's really important because that skin under the arm is very thin, and it doesn't take much liposuction to cause it to really sag and flop around. Right. Now, getting more involved and more drastic is actually trimming away that loose skin. That's a bit of a bigger undertaking and does leave a visible scar. But Body Tight's made a big improvement in that and is now certainly my favorite approach for that problem.
Very cool. Listen, thanks for joining me tonight. It was a funny and interesting conversation, and I am going to start salting away my loonies and toonies, and I'll come see you in about 5 years, okay?
Sounds terrific.
Okay, you take care.